Hello, everyone. It's Friday, July 24th, and regretfully, again, I've got to start off with telling you we've lost two more great West Virginians. We lost a 79-year-old male in Fayette County, and we lost a 55-year-old female from Mason County. It sounds like a broken record, I know, but please don't let these people just become statistics. Please keep them in your thoughts and prayers, as Kathy and I are doing every day, and just know so much that these people have many loved ones, and their contribution to our state has been unbelievable. You know, both these ages of people, 79 and 55, they still had tons of life left. And this terrible killer is still biting at us in many ways. Please remember them, and please don't forget all the others that we've lost before that. But no, West Virginia, you still are doing a great job, and you can continue to even do better. You know, please, please, please take heed to all the advice that we've been giving you, as you've already been doing. And just keep it up. I want to jump just 1 second to this, you know, because this is tremendously important. But there's a young man, a 27-year-old, Jason Cuffey, I think is the correct pronunciation of his last name, the firefighter that was with the city of Charleston in their department, and his funeral procession is going on right now. He's 27 years old, and we've just lost him, and you know, so please also keep that family and this great young man, a hero for the state of West Virginia, in your thoughts and prayers as well. I want to tell you this: over the next 2 months, we will be welcoming home soldiers from our West Virginia National Guard units who have been deployed. Today we welcome home 33 individuals that returned from the 150th Cavalry Regiment and the 201st Field Artillery. Now get this, these soldiers have been gone for nearly a year on all of our behalf, and all the goodness that we have in life, I say over and over and over in this great country, we owe to them. So absolutely we celebrate. We celebrate the return and the deployments that are going on. We absolutely continue to have all those, you know, all those great men and women in our thoughts and prayers always for their safe return home. But today we celebrate a really special day, and over the next couple of months, we're going to celebrate a whole bunch more, because we're bringing people back home, and that's good stuff. I want to tell you this: the Toronto Blue Jays decided, you know, that they're not going to come to Charleston. We made a run at it from a standpoint of having them, with the possibility of having the Toronto Blue Jays come to Charleston at Power Park and play, and play their games there. In Canada, they decided that they did not want them to come back to their stadium. They're going to be playing without fans for the most part, and we made a run at it. You know, yesterday I had a conversation with the major leagues, and they told us that they would surely put it on Toronto's dashboard. Toronto at the time was looking at Baltimore, and they felt like that was not a very strong possibility of that happening. You know, but we just got notification that they landed, and they're going to go to Buffalo, New York. So, which is probably a lot closer to them than maybe we would be. But again, we continue to offer up West Virginia to each and every person that we possibly can, or organization. I want to just touch on just a couple of things. You know, I want to go back to our numbers just 1 second. Yesterday, our new cases in West Virginia totaled 165. Our daily rate jumped up to 4.81. We have 1,604 active cases in West Virginia now. And the bottom line to this is the numbers we don't want to have. You know, when it really boils right down to it, we had a couple of days of decent numbers. We didn't go into a complete celebration about that. I said, you know, they're numbers that we love to see, but one or two robins don't make spring. We still realize that we still have a long ways to go. And things can surely get worse in a big way before they can get better, possibly. We now have 88 people that are in our hospitals. That's gradually growing. Here's something that we're really watching. We're watching very closely. Now we have 253 active cases in Kanawha County, you know, which is now the highest in the state. Mon County, remember, jumped to 390 or 394, I believe, at one time. You know, we may have to look at the bar situation in Kanawha County as we move forward. I'm hoping and praying that these numbers don't continue to rise. Mon County now has dropped, you know, and primarily dropped, I'd say, from, surely it's been a contributing factor about the bars. It's surely been a contributing factor about masks, but Mon County's dropped from 394 down to 231 as far as our active cases. You know, I want to tell you that we are now going to move on the recommendation of Secretary Krauts and Dr. Amjad to a reporting period of once every 24 hours. That's really being done across our country, and it seems like it's more efficient to do it that way because the numbers, you know, change from 10 to 5, and it makes that reporting period a little more difficult. DHHR will switch to a once-a-day reporting in the coming weeks, and Secretary Crouch and Dr. Amjad will tell you more about this. In regard to our school reopening executive order, today I am signing an executive order which will formally allow the public and private colleges and universities to reopen you know, after a lot of dialogue with a lot of the college, with all the colleges and universities, I am totally convinced that these people are completely on their game and they're doing anything and everything they can possibly do to ensure the safety of the staff, the safety of all of our teaching community, and absolutely the safety of our community, but first and foremost, the safety of our kids. This executive order also had to be signed from the standpoint of allowing us to open, you know, public and private K through 12 schools on September the 8th. And so this is not, don't misconstrue that this order is saying, you know, we're going to do this or going to do that. We're still watching everything that comes from the federal government, that comes through our numbers, that comes from our health experts, that comes through every aspect to really see, you know, where we stand and what's going to happen with our schools, our universities, our colleges, and everything. And we're trying to buy as much time as we possibly can, but this order has to be in effect. From a standpoint of our churching community and everything, our churches now, we have active outbreaks reported in 8 counties: Mason, Boone, Grant, Logan, Kanawha, Raleigh, Taylor, and Wood counties. I don't think that's really changed, but we're up to 125 total cases combined. We got to be really careful there because we've been through it over and over and over. You know, at church is an absolute great possibility for the spread of this, and that's why you got to wear a mask, and that's why you've got to social distance and keep that pew in between you and keep on trying to do the very best that we possibly can. I surely know the significance of church. It ought to be probably the number one thing in most of our lives. And so from that standpoint, I get it, but please, please be as safe as you possibly can be. In regard to our small business grants, we're moving right along on all that. We hope, well, there's your stuff, all the stuff that's up on our website and everything. The grants, there's no point in me reading through it and going through that again, but we're moving forward in a good way on that. I want to tell you, we're just a few minutes late starting today. We've had a really productive meeting, with our advisory council and everything in regard to the distribution of monies with the legislature. We spent the last couple of hours with a lot of questions and a lot of good people online virtually as well as with us, and we've gone over everything from how we got through last year to how we're going to jumpstart this year with an incredible lick right in the beginning in regard to our income taxes that we moved from April to July. So we'll jumpstart right out of the gate in great shape. Then we talked about the distribution of our CARES dollars and how we put that all together and how that's all flowing and how we're modifying it and making it better with input from lots of different areas and everything else. We talked about the volunteer firemen and the EMSs and all that kind of stuff, that the possibility of getting dollars out that way. We talked about, some things that are up and coming, thoughts in regard to our fairs and festivals that I want to bring out early next week. And then from that, we talked an awful lot about the grants. The grants now total, and get this number, the grants total $1,147 million that are available to us as West Virginians. Now, our legislature is going to help in every way to see what areas that constituents can, would fall in and be able to qualify for this and everything. What ways that we can absolutely channel and help get monies out. We got great people that are working it really hard from our end, but absolutely, we solicited a whole bunch of help in regard, to the grant programs and everything that's going to come directly from our legislature and all the people across West Virginia. We don't want to leave any stone unturned, and we don't want to leave money on the table. We want to absolutely take advantage of every dollar that we can possibly take advantage. I also gave them my feelings of update on where we're going to be as far as an additional stimulus package, where we're going to be in regard to the $678 million that we put in a bucket of the CARES money in the beginning. And I know I'm talking about a bunch of numbers, but I am very, very familiar with all these numbers because I work them all the time. I know it's difficult to understand, but just to go back, we got in originally $1.25 billion. We set aside in a bucket $678 million for unemployment backfilling as we went way down and exhausted our dollars on unemployment. If we don't have that there to be able to use for that, we could get in a situation where we're going to have to lay on our businesses a heavy burden as far as significantly increased taxation and everything as far as the unemployment buckets. But we got that there. We are absolutely not going to have to do that. Businesses, hear me out through and through. From the standpoint of your unemployment obligations going up, they're not going to go up. Absolutely, we've got that there as the insurance policy. The great part about that is just this. If by chance the federal government would forgive all or a portion of that, those dollars flow right back from the standpoint of all the different things that we could be using them for within West Virginia in the CARES division. We've found a way through the Highway Department. The Highway Department has now found 3 buckets of monies and everything by the way that our Secretary, Bird White, and our Deputy Secretary, Jimmy Riston, have been able to move around and do and free up $130 million, $130 million with 50 of it coming from CARES, but $130 million that we can get out and start really aggressively paving and doing that in addition to what we've already been doing. And so we got a lot of stuff going on. We talked about the last thing we talked over there about, about how you apply. Ann Erling gave a real nice, presentation on how you apply and get through the small business grants and what we're going to do in regard to the we didn't talk the cities and the counties grant dollars that's coming out of the CARES to them. We've got that as far as application of that. We're good to go there. There's some question about how we're going to do the small business stuff, and went through all that, and then we talked some about those that are sole proprietors or entrepreneurs that just do not have any employees at all, just have themselves taking their earnings from profit. We're still working that. We still believe that there's some level of assistance that we'll be able to come out with there. It is very difficult. J.B. McCuskey was there, gave all kinds of insight on lots of different things. What an incredible auditor, what an incredible job he's doing and everything, and all of his department, and he gave so much insight on it and everything. And basically the bottom line of the whole thing was, when we get through this, we've got to have a mechanism that prevents fraud. And that is difficult to bundle up and put together. And with all that, they're working it, and they're working it as hard as they possibly can. Please understand, this is absolutely not one size fits all on everything. It's very, very complicated and everything. We're trying to do it from 1 to 35 people, but when you start trying to do it from none employees, then that opens up a different arena, and we just got to figure it out. We do think we're going to be able to help there, but it's still going to be a little bit of time before we're going to be able to figure that one out. And then the last thing we talked about is just this. And what I've said to you here is, we moved the income tax into 2021. We got through 2020 and showed a surplus. It's amazing. It's unbelievable. We're going to jumpstart 2021 in a great way. We got through today, we went through more and more and more of the CARES distribution, and we got $678 million that's sitting there, that if the feds would forgive the unemployment situation, those are extra dollars that we'll have. We got through small business, we got through, the entrepreneur stuff and everything, and then we talked about what else is there to come. I mean, there's $1,147 million in grants that are designated to West Virginia. It is absolutely unbelievable what we can do. The legislature's going to help. You can help. Any questions you may have, get on the website, pull up the grants, try to find an area where you can fit and everything. And then any questions you have, call us, call your legislators, call your delegates, call your senators, call and see if there's a way that you can qualify. But then in addition to that, we know we're going to have what I've told you we'd have all along. We're going to have a fourth stimulus that's going to come out in, I think, the next couple of weeks or less. In that, there's going to be additional dollars, I think, that's going to be able to go to those that are still unemployed. There's going to be dollars that are going to ensure and make our schools as safe as they can be, back double, triple safe again, and everything for everybody involved, kids, teachers, service personnel, everybody. Now, there's going to be dollars that are going to go directly to the states, as there's dollars that have already come. There's going to be PPP, the possibilities and it may be that if your business is still suffering less than 50% recovery, you can apply for PPP again. Now, I don't know exactly what the rules are going to be, but I'm just telling you as West Virginians, don't be asleep at the switch here. There's still a lot out there that's happening and everything. Stay on top of your game. Consult whomever you need to consult and everything to be able to have the right information to see what you can do. And the last thing I'd tell you that's coming, and it's coming right down the pike, is in this stimulus package, you're going to see an easing of guidelines again to where we'll be able to do, maybe possibly with that $678 million, but we'll be able to do with that, or maybe some additional dollars that are still to come, maybe even some significant expansion beyond the $50 million that we've laid aside for broadband or whatever it may be, because we'll be able to backfill revenue. They won't use those words, but we'll be able to be backfilling revenue in some way or another. So all that's right on the horizon, and it's coming right at us. Now, these are just announcements. The free testing today is in Brooke and Logan counties. Next week, we'll be in Gilmer and Marion counties. We've now sent out, $55 million for all practical purposes to 159 cities and counties on our, that's the CARES money that's going out to them. Please continue to apply. You'll see the stuff as I encourage you about the census over and over and over. Our summer feeding map is up. It's 696 sites. Well over 10,000 people have used this map so far. There's still hungry people in West Virginia, and if you're having trouble, call 211, and we'll help you in every way we can. We don't want any West Virginia to go hungry. I want to talk to you just 1 second about the summer feeding program. It's phenomenal. It's mind-boggling. But the West Virginia Department of Education has received more than $36 million in the CARES Act funding to be used for the period of March and September and through September of 2020. This funding was sent directly to West Virginia Department of Education from the USDA specifically for meal claims reimbursement to counties. Now, get this. As of July, the West Virginia Department of Education has spent $40.5 million in meal reimbursements and over 11,562,577 meals. 11.5 million meals were served during this COVID-19 school closure. And so the last thing is in June alone, the West Virginia Department of Education reimbursed summer sponsors $7.8 million in federal reimbursement money. They reimbursed $7.8 million to summer sponsors in 1 month. And this compared to 1.57 federal reimbursement for the entirety of the 2019 summer food service program. So in 1 month, we sent out 5 times the dollars to people that were helping us with food. 5 times the dollars went out in 1 month to what we did in the entire year last year. And there's a total of 230,000 kids, students, that have qualified to receive the pandemic electronic benefits transfer program benefit for this year. That's $72 million for West Virginia families to use for groceries during this pandemic. There is an estimated total of $113 million in fed dollars that are available for child nutrition programs in West Virginia just this year. So we're taking care of a lot of kids, and our Department of Ed is doing great work. Our National Guard is unbelievable what they've done. The DHHR, our county health departments, it just goes on and on to first responders. You've got a first responder that's being laid to rest today. Right here in the city of Charleston, a young man. one of our heroes. Please remember him. And I think that's all I've got. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. As the governor has shared, although we are doing better than we did in some ways, our RT value is down again today, down to 1.03, which is suggesting that we are making indents in the spread of COVID-19 with our strategies, mitigation strategies with masks and physical distancing. And thank you to the great people of West Virginia for your cooperation and your altruism and your commitment to service for others by wearing a mask and protecting yourself. But we also know that things aren't altogether rosy. If we look in the United States, it took 99 days to get the first million people infected with COVID-19. It then took 43 days to get the second million people infected. Then it took 28 days to get the third million people infected. And recently, yesterday, we passed another milestone. In a mere 15 days from 3 million, we are now at 4 million. So we see COVID spreading in an accelerating way. That's that logarithmic compounding effect. Dr. Birx, who is a key member of the White House Coronavirus Task Force, identified 12 cities in the country where COVID-19 is growing quickly. And that includes Columbus, which is in Ohio, a border state. It includes Pittsburgh, which is in Pennsylvania, a border state. And it also includes Baltimore, which is in Maryland, a border state. And when we look at the RT values, that reproductive score, the R naughts across the country, today, Kentucky is the second highest in the country. So all around us, we see that there's a lot of activity from COVID-19. And it's important to note that across the country and in West Virginia, we're seeing a rise in COVID-19 that is particularly isolated to people that are 18 to 29, and then the 30 to 39-year-old. That age range is accounting for a majority of the new cases in many parts of our country. Like in Florida, the average age in April was 65 of somebody that tested COVID positive. Today, it's 38. So ultimately, we know that our work is not done, that we need to be very much increasing in our vigilance and our commitment to do the things that protect our state. And as we look at the number of cases of COVID-19 that are also increasing in our state, as the governor, articulated to everyone just now, that we know that we need to continue to work very hard, because the single best predictor of the ability to see the economy start to boom and to get back to football games and the activities we want and schools is the status and the amount of COVID-19 that is in your community. Because if it is set deep in the community, then it starts to spread to all of the businesses, all of the schools, et cetera. So West Virginia, you're doing a really good job, but our work is not done. And we need to be even more committed as we're looking at getting the students back in K through 12 and higher education schools in our state, and wanting to do the things that make us happy and thrive. So thank you very much.
Great, thank you, Dr. Marsh. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, along with Major General Hoyer from the West Virginia National Guard, are joining us today and are available for questions. We'll now go to questions from members of the media. The first today is from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Governor or Brian Abraham, if you're there, can you go into a little further detail on the executive orders for higher education and K through 12? I get the K through 12 thing, but I'm trying to go through some of the prior executive orders. I don't see necessarily anything there that had officially had shut down to colleges and universities. I thought they more or less went to online learning and started to do a lot of those things themselves. So can that be a little bit kind of more further explained? Thank you.
Okay, Stephen, I'm going to, our council's working it right now, and they're going to, Brian's going to come on and give you the details.
Okay, Steve, if you look in Executive Order 920, that's when we suspended all educational operations. We did allow for some limited circumstances to occur. Some of the vocational higher education facilities were still operating under those type of circumstances, but we felt it was time that we needed to allow these universities, as the governor had directed, the ability to open up under their own plans, so it was necessary to undo that prior order.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I'm just wondering, when I hear about the small business situation, and I know how long we've been into this, have any actual dollars gone out to any small businesses in the state through the CARES Act money, the grant program that we've been talking about now for weeks? And if not, when do you target that those dollars will get out? Because small business owners are calling me and saying they've been told that it may be the end of August or the 1st of September. So we're still looking at another 4 weeks before any of that CARES Act money from the grant program is distributed to small businesses through your program. Thank you.
Well, Kenny, I'm going to let Brian answer this because he knows this. He knows that end better than I. But he asked if dollars have already flown out or started to flow.
Yeah. As we understand it, many of the applications have come in. There have been several hundred that have already been processed. Those dollars are starting to flow now. So they will be out no later than first of this week coming, next week.
Yeah, I don't have the exact number, but I think that number is somewhere, you know, with what we're processing and what we have already approved and everything, about 1,400. You know, we got a long ways to go and everything, but I don't know exactly where we are, but that number is between 1,400 and 2,000. I don't know exactly the number.
All right, thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. With the surge in cases among the 18 to 29-year-old age group, as Dr. Marsh mentioned, is it realistic to attempt to try to open state colleges and universities on time next month?
Phil, I'd be lying to you if I didn't tell you that I'm concerned. I'm absolutely a believer that these universities and colleges have done incredible planning. Each one of them has their own separate plan of how they can ensure the safety of the kids and the staff and everybody that's there. And they've done great work in regard to that. You know, I'm sure all those plans are you know, public knowledge, or you can be your public knowledge, and you know, all I want to do is continue to believe that we're going to be able to go back to school. We're going to protect our communities and the kids and the staff, and we're going to, that's where we're going to go, because I believe with all in me that we need to go back to school as soon as is. And I emphasize and underline with all in me, as soon as our medical community, as soon as in my gut and in my mind, I believe without any doubt that we have flipped every rock to ensure the parents of these children and all those that are involved, that we absolutely can go back to school and go back to school as safely as we possibly can. We all know, every last one of us knows that this thing is risk, and we want to diminish and minimize the risk. Now, we have also, in addition to that, you know, through the CARES money and we talked about this today with the legislatures, we are now setting aside $5 million for our smaller schools and everything. I'm sorry, it was grant money. It was not CARES money, but we're able to set aside a little more than $5 million for our small schools, to where we'll be able to not only just test the out-of-state students, but we'll be able to test all students, because that's what we should be doing. Now, look, everyone knows, if you're not concerned, then you're not thinking. Everyone knows that our kids need to be back in school. Everyone knows, you should know going in from the standpoint of your governor. Your governor's heart and mind is solely behind absolutely assuring that you will be taken care of as safely and as best possible. Every part in me is going to proceed ahead that way. But I want to be ready, and I hope we can celebrate, and absolutely I'm still very, very hopeful that we'll be back in school.
All right, thank you, Phil. Next, we'll go to Mark Curtis with Nexstar Media.
Yes, good afternoon, Governor and Cabinet. And I'd like to follow up on Phil's question, because not only do we have a spike amongst young people, we have a particular spike among young athletes. We have a large number of cases now in the WVU football and basketball teams. I noticed they've had some cases at Marshall University. And are we possibly looking at a scenario here where, yes, schools open, but athletic activities among the young people just have to be canceled for the fall? I'd like the doctors to weigh in too.
Well, Mark, I would tell you just this. I mean, if I were to come out right now and say, we're not going to have any school other than virtual, we're not going to have any athletics anywhere, we're going to close our colleges and close our universities and everything, granted, there would be carnage all over the place, would there not? From the standpoint, this situation is totally fluid. It moves nonstop all the time. We have got to keep on moving and keep on going. We can't just sit in a corner and draw up and, God forbid, maybe die. We have got to keep moving as best we possibly can until we get to that drug or that vaccine. Now, in West Virginia, from West Virginia's standpoint, they're the envy of the United States, all the states. From the standpoint of going back to school, every state in this country would be running back to school if they had West Virginia numbers. I know what's going on with the athletes. And absolutely, without any doubt, if you could just see and spend 20 minutes on the phone with a Gordon Gee or Jerry Gilbert or all these people that are working at our smaller schools, it is unbelievable what they're doing to assure our safety. And on top of all that, if you'll look at the reporting from all over the place, it may very well be that sector is a sector, if done properly, from the mask and the distancing and all that sector is the least apt to have a problem. And we sure don't want to absolutely harpoon ourselves as far as the economics of our schools. We don't want to harpoon ourselves from the education of our kids. And we absolutely don't want to harpoon ourselves from the safety of all those involved. It's a big deal. And absolutely everybody, all people, all hands are on deck nonstop to assure that we're going to come up with the best possible decisions that we can come up with. This thing's not gone. Now, I'll pass now to our medical team.
Maybe I could just add one thing to what the governor said, because he covered it really very well. As I said before, and this is something I hope really people hear, the single best predictor of success for our schools, our businesses, our athletics is reducing the amount of COVID-19 in that community. If COVID-19 is within the community and it is spreading, then it spreads to all those areas, which makes it much more difficult for us to navigate. If we can suppress COVID-19 even more in the state of West Virginia during this interval between now and the time the governor has mandated the opening of the schools and allowing the colleges and the universities to reopen, then that is the best investment in a thriving future for students, for student athletes, for businesses, and for communities.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi. Some Mon County bar owners have come to us and expressed that they remain somewhat confused by the bar closure orders. And so I have a two-part question based on what they're telling us. Part one is, how do you distinguish a bar that serves food from a restaurant that serves alcohol? Is it based on proportion of revenue, or are there some other criteria? And is there written guidance on that? And the second part, and I need to look at my note on this, the second order eliminates some phrasing that says that restaurants and hotels, service from the bar directly to patrons is prohibited, and no patrons are permitted to sit or stand at the bar. Now, with that language gone from the second order, does that mean I could, like, say, go to Outback and have a steak, but I couldn't have an old-fashioned or one of those oil can-sized Foster's lagers that they serve at Outback? What's the meaning of that? Thanks.
David, here's what I know, and maybe, Secretary Crouch, you could weigh in, if you know more information about this. But I think the licensing for the bars, there is a bar type licensing, that basically is exclusive for just a bar being a bar, just serving alcohol and serving drinks. From the standpoint, David, of the answering of your question, if you were to go to Outback and eat, absolutely, you can sit at the bar, eat at the bar, have your drink at the bar, but you cannot go to Outback and sit there and have a sandwich at the bar and then sit there for, 3.5 hours, having 25 beers. You can't do that. So that's basically it. Again, it's not perfect and everything, and hopefully what we're going to see is the numbers continue to decline in Mon County and be able to release that requirement, the additional 10 days.
Just Secretary Crouch, thank you, Governor. That was a good explanation. There are two licenses, a business license, and then there's the liquor license that bars must get, and restaurants must get that if they serve alcohol as well. So the fact that bars were closed and bars in restaurants were closed was the distinction. So you explained that very well from the standpoint of you can go and eat in a restaurant that has a bar, but they are not to just serve alcohol.
And everyone needs to, if you come back to me just a second, Jordan, everyone needs to understand the problem. What was the problem? The problem is young people just piling in on top of one another with no mask or whatever the situation may be, and lo and behold, we have an outbreak in a situation that we stopped. I mean, did we not? I mean, we were shooting straight through the roof in Mon County. We stopped it by what we did. And that's what I've got to do. That's how I've got to move.
All right, thank you, David. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. My questions have to do with the opioid epidemic, part budget, part operational. Number one would be, Governor, have you been able to move any of the COVID monies to treating substance use disorder? And maybe to Secretary Crouch, have you seen an uptick in any problems that community has had as a result of the shutdown and stay-at-home orders?
Okay, Paul, first and foremost, there are significant dollars in lots and lots of buckets and everything in the grant money and everything. And that's where we need to be concentrating our efforts, in combating this problem more so in utilizing the grant money and not using up our money over here on the left side of the equation. But Secretary Crouch, if you could if you could jump in there, that'd be good.
Yes, sir, Governor. There are funds that come through SAMHSA for substance use disorder. And so we are pushing those funds out to the local folks who need those, our behavioral health centers and others, our recovery centers, our providers out in the communities. With regard to the second part of the question, we've had great concern with regard to of course, when the shutdown occurred, we had very serious concerns about folks not having access to other individuals and not having access to their support groups. We were worried about overdoses, significantly worried about overdoses. We monitored those, as you probably saw a couple of weeks ago. We did have a 6% reduction in overdose deaths. We're still looking for last year. We're still looking at that data closely. We have an uptick in meth, which is very concerning. So we do have those concerns, and we tried for a period of time weekly to get information out in terms of call lines and contact information for individuals. So it is a concern. Individuals who are isolated and who do not have their support groups available to them can end up getting back into trouble again. So we want to try to keep folks safe. So that's a good question, and thank you for that.
All right, thank you, Paul. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. I'm Emily Allen from West Virginia Public Broadcasting. You talked a bit about summer feeding programs and some of the ways that you've been reimbursing schools and money in that area. A really thorough article had come out from Mountain State Spotlight earlier this week talking about some of the limitations and shortfalls to existing feeding sites. They really rely on transportation, which some families don't have. The rations are small. There's not enough days in a month or a week. Is there any plans to use existing CARES Act dollars for the programs that we have in place now, or like allocating additional money to that?
Okay, Emily. Again, I'm not sure that I understand completely everything, but I can assure you that if you'll go back to my State of the State, a big thrust of the State address was to absolutely try to take care of those, from the seniors and the hot meals, or from the kids, leaving school with food in their backpacks and so many different things, because it just seems that if West Virginians can't take care of West Virginians that are hungry, then that's a real problem, real problem with me. And we're so much better than that, and we're already doing that. Now, as far as, the number of sites where people can come and pick up food and whatever, Emily, I think we've got 694 or 96 sites in the state. And, if we need to do more, we'll try to do more without any question, not necessarily just sites, but do more in general. We'll do more, because I surely want the people fed, and I don't want people going hungry, but for crying out loud, we got a real effort that's going on out there, and lots being accomplished.
All right, thank you, Emily. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is about the DHHR computer system. I've previously heard Secretary Crouch say that the computer system is 40, 50 years old. Have we put any thought or funding or plans into updating that? I mean, I don't even know what a 40-year-old computing system looks like. Thank you.
Well, Bill, you can answer what a antiquated computer system looks like, because we have that. We've surely never prepared ourselves in any way for anything like we're dealing with here. But nevertheless, in addition to that, we've got a lot of support from the National Guard and people that have come in and really stepped up. Bill, you can probably elaborate a little bit more about that than I, but I think we're moving, and I think we're moving in a really good direction right now.
Yes, sir, Governor. Happy to do that. And Charles, that's a good question. We have been working on a new system, and I haven't said much about that because the rollout of a new system is difficult. It is tough on our local health departments to get up to speed on new systems. So we're trying to work with them, have a call with them this afternoon to talk about that further. The system is actually called Checks Out. We're looking at a potential rollout in about a week. We're actually pushing the rollout much faster than it would normally be in non-pandemic times. And the reason for that is that this system actually helps with regard to investigations and contact tracing, which, as you probably know, is critical to us being able to stop community spread. So the system, although it has much more capability than investigations and contact tracing, will initially be used for those purposes for local health departments and the state, and ties back into the state. So it is an excellent system that we've been working on for about a month or 6 weeks now. We will tell you more about that as we move towards the rollout of that, but that will ultimately, eventually replace our entire surveillance system for public health in the state of West Virginia, and will bring us up to 21st century. So working hard on that. We're trying to be deliberate in terms of how we do that so that it's as easy on everyone as possible. So thank you for the question.
Great, thank you, Charles. Governor, I'll turn it back to you.
Okay, I just close with just saying this, and this is just a shot back across your bow, West Virginia, and just to salute you again for all the great work you've already done. But just I always take notes to what, our other experts and everything were saying today and everything. But, I want you to go back and congratulate all the great work that our National Guard's doing, and those that are coming home and those that are leaving and all that. And so General Hoyer, we didn't hear from him today, but what an incredible job he's doing. But now, just think about this just 1 second. These people are the people on our front lines. They're the people that absolutely are there giving us the freedoms and the rights and everything that we have in every way. But in addition to that, as I've tried to do with our firefighters, our EMTs, all of our health community, all of our local health departments, all the different people from firefighters to policemen to first responders, from EMS and on and on and on. And I'm going to forget somebody, but just remember the great effort and all the courage that they have had. They are true heroes. Remember this young man that we lost, that's in the funeral procession today, going to his final resting spot, now, and knowing that at least we surely hope and pray he's with the Lord today, and things are okay some way, somehow for him and his family and all of his loved ones. But I want, going back to that shot across your bow, to just say just this. Dr. Marsh said today that our federal government had identified 12 cities: Pittsburgh, Baltimore, Columbus, border state. And then he also said, and Kentucky was first in the nation in the R0, which means that it's transmitting this disease the worst of any state in the nation, border state. Now, know, West Virginia, know how absolutely ripe West Virginia is for this terrible killer to sweep across our lands. You have prevented that. You have stopped that, West Virginia. You have done it over and over and over. As we have given you guidelines, if we have given you notices, you have absolutely taken the ball and ran with the ball, and ran very productively with the ball. Now, imagine just this. Imagine that the state of Florida, who I sat and watched their governor on briefing after briefing after briefing with the president, honestly, just almost set up and talk of how proud he was and how great Florida was doing and how all the great stuff that they had done and everything else. But yet, an incredible amount of the stuff was behind us, behind you in West Virginia. And today, imagine, today, you talk about a problem. Today in Florida, there's a person dying every 8 minutes. Every 8 minutes. They have now had 2,013 deaths in the month of July, and we're not through July. Absolutely, the number of people that they have had tested positive is 237,000 people. Now, we don't want to be Florida. We do not want to be Florida. We're an older state that has all kinds of chronic illnesses. We're an older state that has all kinds of COPD and all kinds of issues. We don't want to be Florida. We have seen what our weapon is, and right here it is. It's just this little teeny mask. That's all, the only bullet I've got right now, and absolutely, please, West Virginia, wear this mask. You know, there was a bunch of you out there that when I said, we're going to make this mandatory, you probably weren't very happy with me. And then very quickly, you saw the president come out there and say, two weeks later, say, you know, we really ought to all wear our mask. Now, our president's urging you, and I'm urging you, just do just that, along with all the other smart stuff that you can do. And absolutely, what we are hoping and praying for in every way, that we'll be back in our schools, we'll be back to as much normalcy as we can possibly be. We'll be back to a situation to where we'll be just waiting for weeks or days for that drug or that vaccine that will absolutely make this terrible killer go away and go away forever, we hope and pray. This thing has been tough beyond belief on everyone. It's been tough on you economically, West Virginia. It's inconvenienced you like crazy. And if it's taken a loved one or a friend of any part of you, I pray, you know, for them, and I pray for you. So let's just keep it up, West Virginia. You're doing great. You still got a long ways to go. Hang in there. Thank you now.